Located in the south of Johannesburg, Lusito School for the Mentally and Physically Challenged was established in 1979 by a group of Portuguese parents under the auspices of the Mental Health Society of the Witwatersrand. Grown from a daycare facility to a fully fledged specialized school for the mentally and physically challenged, this association offers exceptional support to both learners and parents in a safe and warm environment. The school has been divided into two sections, namely the Stimulation Center and the Workshop, which offer the following services: speech therapy, physiotherapy, occupational therapy, educational psychology and biokinetics. Presently, the school has approximately 70 children with disabilities such as cerebral palsy, Down syndrome, other syndromes, learning disabilities and traumatic brain injury. This school equips each learner as best possible for their passage through life and helps and supports them with individualized care and attention. The school has a well-equipped gross motor room for various therapies, well-equipped classrooms for individual attention and group activities, and a beautiful swimming pool area. It's here where Marindalasttx and her team uses the Aquatots swim program applied for special needs children. Aquatots swim program was developed by Nell White over a period of aquatic involvement spanning several decades and originated in South Africa. Aquatots is a gentle sing-song parent-tot group approach to developing swimming ability in infants and toddlers and complies with international standards for infant aquatics. Nell White has become a favored international infant aquatic educator who features regularly as presenter at world conferences and workshops in other countries. It is under Nell White's guidance that Marindalasttx, a registered biokineticist, did her Aquatots training in 1997 and saw the potential it holds for children with special needs. Since then, the Aquatots applied for special needs children has been developed through the medical professional team with the Aquatots family: Leanne Bossinger, physiotherapist; Marindalasttx, biokineticist; Dr. Gerda Joubert, biokineticist; Melanie Horak, biokineticist; and Liz Johansmeyer, occupational therapist. Aquatots applied for special needs children can be used in three different ways. Firstly, physically and mentally challenged infants and young children benefit from the advantages of normal group activity and are given the opportunity to develop initiative, find security and learn motor and behavioral skills by increased repetition and reinforcement in an atmosphere that provides appropriate conditions for achieving therapeutic aims. By doing the activities such as monkey walk on the railing, Aidan, with mild CP affecting his left hand and leg, has the opportunity to use his hand in a fun activity with no pressure to perform and without even knowing that he's exercising his hand. Other Aquatots activities such as crocodile on the step and playing on the landing station all provide ample opportunity for increased muscle strength, balance, coordination and functionality. Secondly, Aquatots applied for special needs children can be used in a group session consisting only of special needs children, where it's not possible to fit in regular classes due to handling difficulties, slow reactions and age. In this class we have Ethan Hector with a chromosome abnormality causing hydrocephalus and agenesis of the corpus callosum and a closed-lipped schizencephaly on the left. He has obstructive sleep apnea and low muscle tone. At 4 months, he was put onto oxygen and was treated for his epilepsy. He had complete developmental delays in all areas and sensory problems. Doctors felt that he would never be able to walk. Rilandi, born on the 23rd of January 2007. At age 4 months, she was admitted into hospital with a rotavirus. The day after she was discharged, she was readmitted with the RS virus and bronchiolitis and had to be tube-fed. Rilandi was making strange eye movements and an EEG confirmed abnormal brain activity and an MMR confirmed West syndrome. She started getting hypsarrhythmia with infantile spasms, and it was concluded that Rilandi had an extremely rare brain condition called lissencephaly. Lee was born on 26 weeks of gestation and was ventilated a month later and had a blood transfusion. He was discharged when he weighed 2 kilograms. In April, he got sick and stopped breathing and was readmitted to the pediatric ward where he was resuscitated. In January 2008, he contracted an ear infection and high fever. He stopped eating and drinking altogether, and it was found that he had fluid on the brain. He is squint and short-sighted and has been diagnosed with CP affecting all 4 extremities with very high tone and uncoordinated movements. Tatum was born in April 2009 and started getting seizures at the age of 3 months. She was diagnosed as having subtelomeric deletion of chromosome 2q, leaving her with very low muscle tone, epilepsy, squinting and brain damage, as well as infantile spasms or West syndrome. Hugo Fioza was born in November 2008 as one twin. A complication during birth left Hugo with cerebral palsy affecting both his arms and legs and decreased cognitive abilities. In the adaptation of specific activities, songs, rhymes, chants and actions taken from the program, Aquatots Applied for Special Needs Children is able to address deficits in muscle strength, balance, coordination and flexibility in infants and toddlers directly as therapy. In this demonstration, using an exercise set to the popular tune of Children on the Bus, we highlight the different applications between the Aquatots Swim program and Aquatots Applied for Special Needs Children, showing how therapists, regular swimming instructors and parents can achieve desired responses in their children with appropriate movement patterns that develop breathing control, control of head, trunk and limbs, and activate writing reflexes and muscles, while simultaneously enhancing body image and developing swimming skills. The regular Aquatots class is aimed at children aged between 9 and 15 months. There is boat song moving, speed fast, 6 parent tot groups, handling all the same, learning at a fast rate, only the second course. The special needs group, older because of developmental delays, boat song standing still due to handling difficulties, speed slow due to time for reaction, smaller parent tot groups for better group control, handling different due to different conditions. Members of this group are happy on their backs, which is the best position for them, and learning takes longer. If the enjoyment of water and learning to swim are part of the able-bodied child's life, they should also be part and parcel of the life of a special needs child. All children need to experience active movement if they are to develop. The lack of such movement for special needs children may well be an important factor in retarding their development. The exercise can be hidden in an activity that is fun, with both the therapeutic and recreational aspects incorporated. From these playful experiences, the child is able to develop concepts, language and intellect, emotional and social behaviors. Water tends to bring all to the same level and provides an excellent means of widening the experience of the special needs child in many ways, including physically, intellectually, socially and emotionally. Playing destroys the idea of treatment and assists in the production of a greater response from the child. The development of breathing control, control of the head, trunk and limbs, and the creation of appropriate movement of these body parts not only assists in the skill of swimming, but considerably enhances body image, partial relationships, and an awareness of the body as a whole unit. Thirdly, Aquatots Applied for Special Needs Children can also be used by our therapist on a one-on-one basis, where they can concentrate on specific deficits, together with other therapy methods available.